So our next speaker is Professor Melissa Brown. Melissa is the Deputy Executive Dean and Associate Dean Research at the Faculty of Medicine and Biomedical Sciences. In this role, Melissa works with heads of schools and centre and institute directors to drive strategic research initiatives within the faculty, and I'll include our own research here where she's been a very good support. The focus of her own outstanding research is that of cancer genetics, in particular understanding the transcriptional and post-transcriptional regulation of several breast cancer-associated genes. So we'll welcome Melissa to the stage.
Okay, good morning, and thank you, Jason, for the opportunity to talk to the audience today. I'd like to start by sincerely congratulating Jason and Jeff and the team for this spectacular achievement of attracting an NHMRC Centre for Research Excellence. This is a really spectacular achievement. We have heard today about the problem that is antimicrobial resistance, and the statistics are truly frightening as a academic and also as a member of the community. So I'm really just so delighted that we now have the opportunity here to work on this extremely important problem. So look, what I've been asked to do today is talk about the University of Queensland as a facilitator of internationally leading clinical research. So what I'm going to do is tell you a little bit about the clinical and more broadly medical research that's done at the university, and to tell you what our approach is, and we've just heard about the importance of research culture at Metro North and RBWH, and it's just so important to build the right research culture in order to be able to achieve the outcomes that we seek to achieve. So look, I'm just going to start off with a little bit of general comments about the kinds of research that we are talking about here, if I can be smart enough to work out how to use this. So several years ago, the University of Queensland undertook an exercise to reflect on its research strengths. And in the clinical research area, noting the clinical research in the broader sense of the word, which, and I've got a caveat on all the following slides, that this includes a lot of basic research which is critical to inform clinical research. These are the areas that the university came up with. So clinical sciences, experimental medicine, cancer studies, immunology and infectious disease, medicinal chemistry and pharmaceutical sciences, so both of these being highly relevant to this centre, neuroscience, public health and health services also relevant here. So the list of all of our research strengths are in the table on the right-hand side. Those that are pertinent to clinical research are highlighted with the red boxes here. So you can get an idea of the commitment, I guess, that the University of Queensland has to medical and clinical research. It is a big part of what we do. If we look at some of the statistics here, just to give you an idea of the scale of our efforts, we have in these red boxes 665 full-time equivalent researchers. So that's a huge capacity that we have at the University of Queensland. The important thing to note here is that this is full-time equivalent based on staff that are holding appointments at UQ. If we consider the individuals that do clinical research, many of them actually have 0.0 FTE in terms of paid appointments at the university. So we have a cohort of about 3,500 academic title holders at the University of Queensland that hold appointments and do research as staff of the university, but they're unpaid. So the actual capacity that we have in clinical research is significantly greater than the full-time equivalent numbers. Now, not all of those individuals are doing research. In terms of our academic title holder community, we've got about 120 researchers that are active in research. So together, this group of individuals bring in an average of about 140 million of research funding, external research funding every year, and publish almost 2,000 publications every year in this area. In terms of quality, we as a university had to go through an exercise that was run by the Australian Research Council, which is referred to as the Excellence in Research Australia exercise that's been undertaken in 2010, 2012 and 2015, where we get scored, along with all the other universities who are active in research, in terms of the quality of the research we're doing. So I'm just going to show you the statistics here of that research which is related to clinical research. So in the broad topic of medical and health sciences, we scored 5 out of 5. Cardiovascular medicine, haematology, clinical sciences, immunology, medical microbiology, neurosciences, oncology and carcinogenesis, public health and health services. We've scored 5 out of 5 on every single one of those discipline codes. So we are doing a lot and we're doing it well. Increasingly, people are talking not just about being active in research. We all run around getting grants and writing papers, but there's much more to research than being active. We need to actually demonstrate that there's impact. Just a few examples of impact arising from research that has been undertaken at the University of Queensland. I won't read through all of this, there's too much writing here, but I think it is fair to say that the university has been together with our hospital partners, importantly, very active in developing research outcomes that have had impact in the clinical space in a number of different disciplines. So how do we actually go about this? So part of what I've been asked to talk about today is how we facilitate clinical research. We obviously couldn't do this without our very strong hospital partnerships, of which there are many. UQ is quite unusual in the Australian context in terms of the number of hospital partners we have. There are 16 hospital partners in the state of Queensland. I've just got the major ones here that are located in Brisbane, so we've got 8 hospital partners here just in the city. So this is quite unusual compared to other universities in Australia where they might have, a major hospital partner or maybe a couple. We have a presence in a large number of our hospitals, which really is a strong enabler, clearly, of doing clinical research. With those hospital partners, we have a large number of research groups and research centres. I've just listed the research centres here. So on all of our major hospital partner campuses, we have large and very active and high-performing research centres. On this campus, next door to this building, there's the UQ Centre for Clinical Research. On the recently opened Lady Cilento Children's Hospital campus, just last year, we were pleased to open the UQ Child Health Research Centre. On the PA campus, we have the UQ Diamantina Institute, and spread across the Mater campus in South Brisbane and also PA campus, we are in partnership with the Mater Hospital to have the UQ Mater Research Institute. So our other enablers, in addition to people and partners and research centres, are places, and we are participants and partners in a large number of fairly recently opened centres, notably including the Translational Research Institute on the PA campus, and as I mentioned, the Child Health, Centre for Children's Health Research. It's very confusing with the Centre for Children's Health Research, UQ Child Health Research Centre. Anyway, we just like to keep the acronyms going, and this building here, as I said, opened last year. The Herston Imaging Research Facility, which is part of the UQ CCR complex and is so therefore in the next building. Within the University of Queensland, I'm here representing the Faculty of Medicine and Biomedical Sciences, but the clinical and medical research effort spans a large number of faculties and university-level research institutes. You've heard about a number of these today, and a number of these faculties and institutes are participating in this Centre for Research Excellence. So notably including the Faculty of Health and Behavioural Sciences, where we find the School of Pharmacy, and Jason has a joint appointment with our faculty and that faculty, including the Institute of Molecular Biosciences, which incorporates the IMB Centre for Superbug Solutions, and also the Australian Infectious Disease Research Centre, which has been mentioned a couple of times today, and I'd just like to acknowledge that Mark Walker, the Director of the Australian Infectious Disease Research Centre, is here today as well. So for the last few minutes, I'm just going to focus on the activities in the Faculty of Medicine and Biomedical Sciences, and that is a faculty where 50% of the medical research of the University of Queensland is undertaken in terms of NHMRC budget. We attract each year 50% of the university's NHMRC funding, and the majority of the clinical research, because the majority of our clinical researchers have appointments in the faculty. So just to give you an idea of scale, the research active staff, so we have a large number of staff, as I mentioned before, in terms of people who are active in terms of attracting grants, publishing papers, supervising research higher degree students. We have about 336 academic staff. Those that are classified as high performing, and I'll show you why I've done this in a minute because it helps us to get some statistics on this group of people. These are staff who have attracted a grant as a chief investigator, first-name chief investigator in the last 3 years. We've got 186 academic staff, and notably 38 of those are our academic title holders who are employed by our hospital and health services. So based on those individuals, we can have a look at the breakdown. So of our high-performing researchers in our faculty, the largest proportion are doing research only, followed by teaching and research academics who are obviously teaching and research, and followed closely by our academic title holder appointees. The majority of the research that's done by our high-performing researchers in this faculty is actually clinical research, which is highly relevant to today. And it's mostly done on this campus, the PA campus, or St Lucia campus. Notably, again, related to the topic of today, is that the largest proportion of our research falls into a research theme in terms of dollars in the chronic and critical illness research theme. So I'm not going to go through this in detail, but just to give you a little bit of a flavour of the kinds of funding that we attract. So Centres of Research Excellence are really flagship programs. We're here to celebrate and launch one of these today, but just noting that this is one of now six centres of research excellence in the faculty. We're hugely successful in attracting research fellowships for our next generation of researchers and our senior researchers, and also highly successful in attracting philanthropic funding. So what are we actually doing to continue to support and to grow our research activities? Just broadly, we are supporting our people by having grants to really support our emerging leaders. We support our research projects and programs by having readership schemes. We have a number of high potential translational research programs that we're trying to grow, and I'll tell you about those in a minute. And we're also trying to recognise the possibility of new translational research programs that might bubble up from new collaborations that we have with our other partners. So I'll just tell you, and also we're building our clinical academic workforce. So we do poorly as a university in graduating MD, PhD students compared to other universities in Australia and compared to the United States with the statistics. So we've got a huge effort on at the moment, and I think this is highly relevant here. We've just launched a number of scholarship schemes. The application closed on Monday, and we've been delighted with the response that we're getting. It's partly about educating people in terms of why would they actually do that? Why would they consider combining their MD degree with a PhD? And when you talk to students, and I've talked to a lot over the last few months, it's surprising that they just don't understand research. They don't understand the point of it. They don't see how it might fit into their medical career. So we're working hard on turning that around. So in terms of our high potential translational research programs, we undertook an exercise last year to identify our real flagship programs in translational research and provide them with a significant amount of support. And it's notable here that critical care was identified as one of our really top performing areas, which is completely consistent with the NHMRC Centre for Research Excellence. So we have made available a considerable amount of faculty funds. The Deputy Vice-Chancellor of the University, who's also our current Acting Executive Dean, has a program available to help people to build these teams and attract further funding in the future. We're working with other hospitals outside. We have a partnership with the Ochsner Health System in New Orleans, and we are undertaking new research with Ochsner. We've also set up a number of networks across the university, notably including the UQ Child Health Research Centre network, which now has 400 members, 200 of whom are clinical academics. We're trying to support multidisciplinary research. We all know that the future of research is team-based, multidisciplinary, problem-informed and evidence-based, and so we recently ran a symposium to bring together people from the Faculty of Engineering to work with people in the Faculty of Medicine. One of the future opportunities that we're just about to launch, which will again be very relevant to this area, are new flagship programs, which we've called Health Outcome Projects, HOPs, which will be specific, targeted, iconic research programs, which will be highly managed, very well funded, and enable translation of research, so not just activity, but the potential to actually translate research in a managed way through the translational pipeline. We are members of the Brisbane Diamantina Health Partners, and looking even further forward in the future, we are hoping to be awarded status by the NHMRC as an NHMRC Advanced Health Research and Translation Centre, and the success of this centre will be absolutely pivotal to that going forward in the future. Thank you.